Welcome back, eDoctor trainees. I'm Dr. Untara Shaikh, the Program Director at MedSmarter USMLE Test Prep, based in Atlanta, Georgia. And today we will be going over the question and answer that you have submitted based on our GI infection lecture. Okay, so let's start. So the first question that I have over here is, what advice should we be given to the patient who is suffering from cholera without sign and symptoms of dehydration, and when this patient needs follow-up? So this is what we have given in your lecture also already. But what is happening, the patient, when they don't have it, they no sign and symptoms of dehydration, they can be treated at home. And given these patients, what we will give them, we are just going to give them ORS, okay? And for 2 days, and then if the patient is having increased number of watery stools or not eating or drinking, and they have marked thirst and repeated vomiting is there, or any sign indicating other problems like they have blood in the stool or fever, then you will be reassessing them. Otherwise, they don't need to be coming to you. And there is the fluid thing. If they have no dehydration, how much we are going to give them? Child that less than 2 years, we give them 50 to 100 milliliter of ORS. And if child is 2 to 9 years old, we give them 100 to 200 milliliter of ORS. If the patient is more than 9 years, as much as we want, we can go up to 2,000 milliliter per day. Question number 2, how we can differentiate between viral and bacterial GI infection. So viral and bacterial infection, they can be confused because they both carry some same symptoms, okay? But viral infection is an intestinal infection that is marked by your watery diarrhea, abdominal cramps, nausea, or vomiting, and sometimes they can have fever. The most common way to develop this is often called as stomach flu, is through contact with an infected person or by injecting contaminated water or food. And the patient can likely recover without complication if it's in a healthy person, but for infants and older patient and the patient who have immunocompromised system, this viral gastroenteritis can be deadly. There is no effective treatment for viral gastroenteritis, so prevention is the key. So how we will prevent it? By avoiding food and water that may be contaminated, and by thorough and frequent hand washings. These will be the best thing to do. So depending on the cause, these viral gastroenteritis symptoms may appear within 1 to 3 days after infection and can range from mild to severe, and symptoms usually last from a day or 2, but occasionally they may persist as long as 10 days. Because the symptoms, as I said, are similar, so they can be confused, this diarrhea, with bacterial. So whereas the bacterial one, on the other hand, is the inflammation of the gut, okay? This is the one that's our inflammation of the gut. And so what is happening, stomach and intestine both, and they have vomiting and severe abdominal cramps and diarrhea. So symptoms occur when? About 2 to 6 hours after eating the contaminated food. And so this is known as food poisoning. And so bacterial infection also result from poor hygiene. Infection also occur after close contacts with animals or consuming food or water that's contaminated with bacteria or the toxic substances bacteria produces. Okay, so this is the difference between these two. It's very hard to differentiate between these two causes. So over here I have differentiated the stomach bug and food poisoning. Stomach bug is your viral, okay, and the food poisoning is your bacterial. So viruses, they take about 24 to 48 hours after exposure to show the signs and symptoms. It can be diarrhea, fever, vomiting, stomach or intestinal cramps, joint stiffness, or weight loss can be there. So, and what we need to do, we need to wash our hands, okay? On the other hand, the bacteria, it can be food poisoning, can be bacteria. It takes about 2 to 6 hours after eating contaminated food. It can cause diarrhea, fatigue, vomiting, and again we have to be very careful cleaning up our equipment in which we are making our food. So this is the answer for your question number 2. Question number 3. So can upper respiratory tract infections cause the GI infection, as is always related to stomach flu, as we observe such cases in extreme hot and cold weather? So sometimes people make mistake symptoms of stomach flu or gastroenteritis for the viral infection. We commonly call it flu, but they are not the same thing. They are different things. So stomach flu happens when the patient's stomach and intestines are inflamed and irritated, and the cause ranged from bacteria can be there, viruses can be there, parasites to food reactions, and unclear water can be there. So flu comes with symptoms like fever, congestion, muscle aches, and fatigue. The cause is the influenza virus. More severe cases can lead to life-threatening illnesses like your pneumonia, and antibiotics are sometimes used to treat the bacterial gastroenteritis, but they do not work against flu viruses. So these are entirely different things. So stomach flu, when stomach and intestines are irritated and inflamed, and flu is the symptom with fever, congestion, muscle aches, and fatigue will be there, and that will be your influenza, and it can lead to pneumonia. So these are two different things, okay, not the same thing. And yes, it is related to cold and hot weather also, but it's not the same. Question number 2, how frequently should patients suffering from cholera and ORS be assessed? So this is the same thing that we have talked about in our lectures. Okay, so I'm going to just repeat the same thing because it was given in your lecture, the WHO guideline for cholera management. So what are the steps in the cholera management? Assess for dehydration. Okay, you need to rehydrate the patient and monitor frequently, and then reassess hydration status. Maintain hydration, so you need to replace ongoing fluid losses until the diarrhea stops. Administer an oral antibiotic to the patient with severe dehydration and feed the patient. So this is your guideline for cholera management. Then again, we have more detailed guidelines for the treatment that evaluate the degree of dehydration upon the arrival. When the patient comes to you, rehydrate the patient in 2 phases. So rehydrate for 2 to 4 hours. If the patient comes to you in the hospital, okay, you need to, this is what all this is there. Maintenance, till when you are going to give until the diarrhea gets away. Okay, so register the output and intake of the volume on pre-designed charts and periodically review them. Okay, this is what is going to happen. And then use intravenous route. So during the dehydration patient, you need to infuse about 50 to 100, and then moderately like that. So intravenous route will be during the dehydration phase for severely dehydrated patients for whom an infusion rate of 50 to 100 milliliter per kilogram per hour is advised. And for moderately dehydrated patients who do not tolerate the oral route, and during the maintenance phase in patients, consider high stool purges like more than 10 milliliter per high. So that's are the one that will be going to give them the intravenous route. Okay, we are going to give them through the drip. Another more detail. So what is this? During the maintenance phase, what happens to use the ORS at the rate of 100 to 1000 milliliter, match ongoing losses with ORS administration. Discharge the patient to the treatment center if oral tolerance is greater than or equal to 1000 milliliter per hour, or urine volume is greater than or equal to 40 milliliter per hour, and stool volume is less than or equal to 400 milliliter per hour. So this is how you will be treating the patient on cholera and maintaining on the ORS. Okay, I would like to thank our team over here, the trainings who have asked questions, and the volunteers who have been screening in the question answer process. So I will wish you all the best and happy studying.